It's time now for 814 Your Health Check, brought to you by Gloria Gates CARE, and we are joined alongside a very special guest today, Dr. Zeev Neuwirth. Thank you so much for joining us today.
Oh, my pleasure. Thank you.
Absolutely. So you're an author, a host, and a speaker, and now you're doing a lot of work with Gloria Gates CARE. So just first of all, tell me a little bit about you and how you found Gloria Gates.
Yeah. So I've been a doctor, a general medicine doctor, for about 35 years. And taking care of people all over the country, in New York and Boston and Philadelphia, mostly on the East Coast, Carolinas. And I've been really, I would say, concerned and frustrated with the healthcare system and sort of the lack of humanity and respect and dignity that it affords most people. And so I've been on a real mission to humanize healthcare delivery. And I've made it my business to really study healthcare in the United States and to understand what the best are doing. And so that's how I started a podcast about 8 years ago. It's the longest lasting healthcare podcast in the country. I've written 2 books on healthcare, and I speak, like you said, all over the country.
Yeah, and so, I mean, you've been just about everywhere, but you know, like you were talking about, you are looking for new innovative ways for healthcare, and that's something that Gloria Gates CARE is doing.
Yes. So I happened to find Gloria Gates CARE, or they found me, and I came to visit for one day, and I have to tell you and just be totally honest about it, I've never seen anything like it anywhere in the country. And you know, coming from, I'd never heard of Altoona and never been in this area. And I thought, oh my God, you know, I've been to Boston and Stanford and Yale and Harvard and New York City, and this model just blew me away. I've never, again, I think it is the only scalable, sustainable model of primary care for the masses of Americans that makes sense to me so far. It's a little complicated to explain it, but it's really about taking care of people. It's really phenomenal.
Yeah, anything in particular you can think of that sets it apart?
Well, there are really, the model is what we call a 3C model. The first C is that it's capitated, which means that it's a membership model. So people pay a certain amount of money each month, and that actually lowers the cost of care versus sort of like paying piecemeal for care. It's kind of like, the first C is the best way to explain it. It's like going to a gym, and let's say you go to a gym and you pay, you know, $15 or $20 for a membership fee every month, and then you walk into the gym and you want to use like the bench bar, and they say, oh, that bench bar is going to cost you another $5. And then you want to use the weights. Oh, that's going to cost you another $3. Well, that's American healthcare. It's everything costs you. It's all a la carte, and it gets really, really expensive. So making it a membership fee actually lowers the cost of care. The second C is that we take about 80% of what most people need and put it under one roof. It becomes a one-stop shop. And that cuts out all kinds of like administrative costs. It cuts out all kinds of extra costs. So that's the second C. And by the way, so Gloria Gates CARE offers physical therapy, behavioral health, generic medications are on site, laboratory tests, cardiac testing, x-rays, all that is offered in one-stop shop. So you don't have to go all over the place and don't have to pay all those extra fees. It's all in that consolidated primary care service. And the third C is care advocacy. So what we know from the science of healthcare, and this has been researched for years and years, is that most of the costs of healthcare don't have to do with your medical care. They have to do with your life circumstances. And so things like transportation, food, housing. And so we have a whole care advocacy team on site that will meet with people, and we'll talk about, do you have issues with finance, with your housing issues, with employment issues, even just navigating the care system. For every doctor we have about 40 people that are focused on you as a person. There is nothing else out there in the country that I am aware of that looks anything like that. So I know that's a lot to say in one breath, but it's the capitated model, the consolidated services, the one-stop shop, and the care advocacy, which again is unparalleled in my experience.
Yeah, that's incredible. Yeah. What about feedback from doctors, nurses, just people that work there?
That's a great question. So once doctors and nurses learn about this model, we're going to have a line out the door for people wanting to work there. Most doctors spend somewhere between 2 to 4 hours a day doing administrative work, essentially data entry and data retrieval, filling out insurance forms, filling out claims, billing, all those sorts of things. We call them prior authorizations, getting approval to do tests. We've eliminated almost all of that. So doctors literally get back about 2 to 3 hours every single day. And like I said, there's a team of about 40 people around the doctor taking care. I mean, my wife's an infectious disease doctor. She does stuff that, I mean, literally calling up patients, kind of, ordering things for patients, paperwork for patients. We've got a team that would do that for her. There isn't any doctor or nurse or I know that wouldn't want to work in an environment like that where you're supported and you've got all of that paperwork taken off your plate. And again, I'm not kidding you, it's hours every single day.
Yeah. Wow, that's incredible. And all-inclusive care, Gloria Gates CARE, certainly changing the game. And we have all the information there on your screen. But doctor, thank you so much for joining us today. Really appreciate it.
Thank you.